Welcome to the November 2013 Connell Seminar Series on Healthcare Reform. Introducing the panel is Connell Insurance's Tom Jensen.
For the second part of this morning's seminar, we wanted to do something a little bit different. We wanted to do something different, something more engaging, more interactive, that would allow you the opportunity to ask the questions that are pertinent to your organization, or maybe on a high level, maybe a little more granular, but just as you see it from your standpoint at your place of employment, with healthcare reform, what are the questions that you need help with? So with that thought in mind, the approach we wanted to take was assembling a panel of experts, and while we are experts with, and I'll let them introduce and give a short bio, but as Rahgy mentioned before, this bill is so complex. There's so many changes yet to be determined. No one professional can know all the answers. No one professional can know every answer because it hasn't been lined out. It hasn't been applied. We're still practicing it. So you may have questions that we don't know the answer to, and that's okay. We'll make sure we get your questions and get back to you and research, do the due diligence, and let you know as soon as possible. So this second part is purely a question and answer time for you to do just that. Ask the questions that are on your mind. So before we get started with the questions, I got my first one back here. I'm going to ask that our panel just take a minute or two, introduce yourself and your area of practice. And I guess I'll do a short introduction. Courtney Vomund with Pazinelli is our ERISA legal employee benefits COBRA attorney with her expertise. Patty Stoner is our accountant CPA with the Whitlock & Company. She's a partner with the agency. And then Cynthia Dominique is also with Anthem, and then we know Rahgy. So we have two insurance company representatives. Rahgy's focus was small group, anything under 50, and Cynthia's was over 50, so large group. Okay, so the question that I wanted to pose to the panel first, after Rahgy gave us all the answers, I'm sure nobody has questions other than a couple of us, but I wanted to ask our legal, ask our accounting professionals, after hearing that, what one or two pieces of information would you supplement it with? For 2013 yet, we had our Department of Labor notices that had to go out. Is there anything else that we should be looking for the rest of this year, and also 2014, some of the big changes?
Sure. Well, there are quite a few requirements other than the employer mandate, which I'm sure we will discuss a lot today and give you some additional information there. But there are some requirements that go into effect in 2014 that will be applicable under most or all of your health plans. Things like no more annual or lifetime limits, no pre-existing conditions for anyone, not just individuals under 19, no rescissions of health coverage. There are quite a lot of requirements that are going into effect, even though many of them have been delayed until 2015 with the employer mandate. And those things require you to make sure that your carriers have updated your plan documents, that you've updated your own plan documents. If you have cafeteria plans, you have that 2,500 FSA limit. You now have a possibility to carry over an additional 500 to the next year. If anyone, that's new, that's not related to healthcare reform, but it is related to some benefit updates. There's a lot of things that you have to stay on top of, and today we're going to help you make sure that you do that. I don't know if you have anything else, Patty.
Not at this time, because I think most of it will come around the measurement and tax questions and things like that. So
You had a term in there, FSA. Raise your hand if you offer a flex spending or, okay, so keep your hand up if you have questions about some of the changes to the flex spending. So we've seen those, we're good. We have one question already in the back, and I'll let you ask that. Dave's going to run around with the microphone. We want to make sure we get the questions recorded so that when we hear the answer, we'll have that as well.
We have 4 closely held companies that are tied together by ownership, in some form or fashion. We have 22 full-time employees, but we employ probably another 60 summertime or seasonal employees. And from what I understand, we're going to have to use a calculation with those hours that those people put in, and that could raise our threshold up to the 50 number. Is there, are we in trouble with our closely held companies right now? We consider all the employees kind of under the same umbrella, and we pay 100% of a platinum plan for all of our employees that are full-time.
Yes, you will have to track the hours because the IRS is going to require, and I'll talk about, I refer to the IRS because those are the codes and the regs that I follow. Health and Human Services as well as Department of Labor have similar, and they try to make sure the terminology, I think, is all the same, but I'll refer to the IRS most of the time. Yes, you is a closely held company, but if you have common ownership between those, then a controlled group rules apply. So yeah, you're going to have to include your count. There's record keeping requirements to make sure that you keep how you compute, whether or not, to determine whether or not you fall under the penalty rule. So if you're the applicable large employer, you have that worksheet to do that. And then it's a little different than when you start measuring. Once you know you're in that threshold, then you're using those same worksheets in different ways.
Okay, there hasn't really been an explanation of how you calculate that. Is it so complicated that we can't?
That's why this is a little bit different than the forum that I've done before. So hang on just a second.
So just to back up, because I'm not sure, from your question, I'm not sure, have you completely determined that with your seasonal employees and with your control group situation that you reach that 50 employee threshold, or are you totally not sure?
Well, I'm totally not sure until I do the equation, but my guess is there's a possibility I could exceed it.
Right, so.
Because seasonal employees usually put in over 500 hours a season,
So right, so just a couple threshold points, and it's a very confusing situation when you have multiple companies, also when you have employees that do not work the entire year. And we have regulations that speak to some of these issues and have left us waiting for more guidance on others. But in general, when you have multiple companies that are related, you may or may not have to count all those employees together. As Patty said, the control group rules come into play, and in that situation, you have to, not all related companies are a control group, and you have to be a control group in order to have to combine all of those employees. If you have a company that owns 80% or more of another company, those companies are going to be considered together. If you have companies that have a bunch of common ownership but do not necessarily own each other, it's possible that you might not have the level of common ownership that will require you to combine those companies. So that's something that you need to speak with your lawyer or your accountant about. After that, seasonal employees, if they fall under the seasonal employee definition in the regulations, you don't have to count them in considering whether you meet that 50 employee threshold. So with some of those people, you may not have to count them. You can throw them out for your consideration. So it's very possible that you could be over that 50, but it sounds like you have some pretty complicated issues that you need to look at individually.
We also have a situation where some of our employees have chosen not to take our plan because maybe they're older, they've had pre-existing conditions, they're afraid of losing the coverage they've had for themselves, and we compensate them for what that policy costs them. What's going to happen to that provision?
That will not change. You have to offer coverage to your employees, but they don't have to take it, and you're not penalized for those employees not taking it as long as they're offered coverage. So I don't see any reason why you would need to change that policy you have in place at this time.
Sean's question was to clarify seasonal employee versus just part-time.
It's a 120-day rule. The IRS has also said you could use 130 hours per month as well. So what I tried to do was do an example because we get the question an awful lot. This is just an example of several employees, And really, you already know who your full-time people are. In this case, anybody that works 1,560 hours a year is going to be your full-time employees. So if that's not the question, you're going to concentrate on your part-time people. So that's what I've done at the top of the schedule. Since they delayed it for a year, you're going to be required to do the look-back periods a full 12 months. There was some opportunities for 6 months, but that kind of went away on this applicable large employer definition. So you look at what the hours they are for the entire 12 months during 2014 in this case, and then you divide it by 130, as long as this is a rule that you're going to use consistently, because that's the other thing with some of these safe harbors that are coming down. So you come up with your total equivalents. 7.9 is in the first month, 8.23, and so on. And I've just used 40 as full-time employees just to make that part simpler. So the question is, do you average 50 full-time employee equivalents during the entire year that make me responsible for this penalty? And under this example, only 3 months they did, so they're not going to be liable. So that's the kind of thing that you need to go through in your worksheets and figure out. Does this help?
Go ahead.
In calculating the full-time equivalency there for employees, are there any exemptions for people who are employees who are enrolled in either Medicaid or Medicare programs? We operate the County Sheltered Workshop program. We've received conflicting information as to whether or not our disabled employees are to be included in that calculation or not.
My understanding is that those employees will need to be counted in your total employee count. However, employees that have government health programs, those employees are already considered to have a compliant health plan, so you would never be charged a penalty for those employees. But I don't know of any exemption from counting those employees in your total employee count.
Again, I think Rahgy did a great job this morning highlighting, whether you have a penalty coming or not. But I just wanted to toss one out on the large employers. So anything over 50, Cynthia, if you would, just a scenario that I would use is if I'm an employer with 55 lives, and if I don't offer insurance, what's that look like for me in 2014? In 2014? In January 1st of 2015.
Oh, okay, in 2015. Just like Rahgy had mentioned in his PowerPoint, and the law does go into effect. It was delayed, so in January 1 of 2015, if that employer would have to offer insurance, so that's where the calculations would go in place. If they don't offer it, they would be charged that penalty based on the two scenarios.
Okay, so for our own edification up here, how many employers do not offer insurance right now? Show of hands. Okay, a show of hands if you are over 50 lives and don't offer. Okay, so do you have any specific questions related to how that may impact your organization surrounding the penalties, affordability, looking at that? Okay. Okay.
To make 100% sure that we are going to hit the 50, because we're in the restaurant industry. So we don't have employees that we have a running cycle. The last 10% is constant turnover. How is that determined from period to period according to the spreadsheet? We may be fine. We don't have, a large number of full-time employees. I think we're at 30 probably within our 4 restaurants, but we have a lot of part-time employees. But there's a good 15% of that is just a reoccurring in and out the door.
Well, the first thing is the 50 requirement is just full-time equivalent. So it doesn't matter about the names. It's just the number of hours that you're employing. Do you run over that 50? Then once you're past that, then you've got to figure out, okay, well, since I am responsible for the penalty, then at that point you switch and you start analyzing it by a specific employee to determine which employee you're going to be responsible for to offer them health insurance, and then do they average 130 hours a month.
So would you do that
For
with
the
just
period.
all current employees, or would you attempt to look back since one employee is replacing another?
you would do it for the specific employee. You know, once you get past the first stage, am I liable or not, then it's completely different. Then it's by employee basis, and does this particular employee work an average of 30 hours a week or 130 hours a month? However you determine you want to measure it. And there are some cases where you can have classes and you could choose a little bit different method to measure that. But basically, 130 hours a month is going to be your threshold that you're going to be watching. Then you got to determine what your measurement period is. Then you are allowed an administrative period and then a stability period. Do you want me to go into that in a little more
Please.
detail?
Yep.
Yeah.
Sorry, I didn't know what the setup specifically was going to be today, but I really felt like Excel provides a little more information than in a PowerPoint, and I apologize if you can't read it, and I'll certainly
Oh, I'm
have
an
them
Excel
email
fan.
this out, because these are just examples that I've used. I've tried to highlight by color to identify, let's say, the measurement period for 2014, in order to determine for 2015 your liability for which employees you're looking at. I've selected a 6-month. It can be 3 months up to 12 months. Your stability period's got to match that, but it's got to be at least 6 months. So for simplicity, I just use 6 months. They allow you an administrative period after your measurement period's over, but the coverage has got to start January 1 of 2015. So in blue, I've highlighted 6 months, and you know, in order to start coverage by January 15, I'm choosing 3 months for an administrative period. It could be 2.5 months, it could be 2 months, it could be 1 month, whatever you think. But this administrative period's where you're doing the math, double checking the averages for each of the individual employees. You're then notifying the insurance company, notifying the employee that they are available for coverage, and then getting them enrolled. So that's what that administrative period is for. And then there's the stability period. So for the 6 months where there's the blue, that's where you look at their averages, and I have a column there that says average hours, and I don't know if you can see that, but it's the last column on the right that's blue. So if anybody in there averages 130 hours, and there's only one person, and that's, you probably can't even see the name up there, Ellen. So Ellen averages, and then also, it's either Stanley or Birdie Crane. So those two people, you would have to offer health insurance and have them set up to start at the beginning of the stability period. For the first year, the stability period is going to be January 1. It's got to be at least 6 months. So we've got 6 months that's in red. And then I'm still tracking the hours, but it doesn't matter because those two employees, I will have to offer coverage for them for 6 months in 2015. You have no choice. But you're also starting another measurement period potentially, and that time's going to overlap. And I was kind of talking about Courtney about this earlier, because most of the things in the regs, they have focused so much on this first year. I think it's a hard concept to understand because what happens in the second year? So in this case, it's a 6-month stability period, and let's say these two employees worked under 130 hours average. It doesn't matter, you have to cover them for 6 months. Then at that point, you look at the new measurement period, you have an administrative period, and then you have another stability period. You can change your measurement periods, but you got to elect it before your measurement period starts that you had already previously selected. So if I had selected April 1st, 2014, April 1st, which is the fourth column in the middle column in the red or the pink, that begins the new measurement period. So then those people that did average less, so they may be on your insurance, and this is where I'm not sure with the insurance area. Does that mean that your plan year really runs 6 months for them? And I guess it does. So that's your measurement period for what's going to happen, how long they're going to be covered. Does that help a little bit?
Is that confusing?
The whole thing is confusing, I know that.
So the question was...
It does, but your measurement period that you pick has to be the same each year. It can be 3 months up to 12 months, but it has to be a minimum of 6 months. So if you only had a 3-month measurement period, you got to cover those people that qualified in that 3-month period. You got to cover them for 6 months as a minimum. If you have a 12-month measurement period, then you'll have to cover them for a 12-month stability period.
Okay, for example, if you have 150 employees, and basically you hire 130 of them as a part-time to make sure they're all part-time, so you only pay for 20, or you don't fall under the over 50 employees full-time. Because in our industry, we were thinking of going part-time.
Okay.
Most of the employees.
If your full-time equivalents are, let's say that you did qualify with your full-time equivalents because you have a whole lot of part-time people, so you are subject to the penalty. But if you keep all your employees under the 30 hours, they're not going to be ones that count that require you to offer insurance. But you would still have a penalty for those that work full-time because you met the threshold of the 50 full-time equivalents, even though those same people aren't going to count.
So that's actually a pretty interesting employee makeup as far as this whole scenario goes. Just to make sure everyone understands does everyone understand how you figure out if your part-timers are going to take you over that 50 threshold? Does anybody not understand that? Okay, so you take your first you take all your full-time employees, and those are people that work 30 hours a week or more. That's easy, right? The full-time equivalents are your people that work less than 30 hours. You take all those people, you add up all of their hours, and you divide by 120. That will create the number of full-time equivalents that you get with your part-time employees. So you might have, if you have 130 part-time employees, it depends on how many hours they work. You're going to add all those hours up, divide them by 120 for a month, and you're going to see how many people you have. If those 20 full-fledged full-time employees plus the number that you get from that calculation equals 50, then you're going to be a large employer, and you're going to be required to pay attention to these rules. So if you are over that 50 with all those part-time employees, and say you decide not to offer health coverage, one interesting thing about all of this is these penalties only apply to full-time employees. They don't apply to full-time equivalents. So once you get past that calculation of whether you have 50 full-time equivalent employees, the part-time employees no longer are relevant to you anymore. So then you're only looking at penalties for full-time employees. You have a 30 employee credit that applies to the penalty. So if you have 100 employees and you choose not to offer health insurance, you're going to have a $2,000 penalty for each employee minus a 30 employee credit. So you're going to have 70 employees times $2,000. Now, if you only have 20 full-time employees, that 30 employee deduction, as far as I can tell reading the rules, it makes it so you're not going to have any penalties at all. So you may have an employee makeup where you have so many part-time employees that you still aren't going to be penalized if you either don't offer health insurance or if your health insurance is not affordable to your employees. Does that make sense? Okay. That's true. That may be a loophole that gets closed, but as of now, that's what the rules say. There are no dumb questions. If your question is like, there are no dumb questions at all.
We pay 100% of our employees' health insurance. But at the same time, we always offer the supplemental policies for like accident, dental, vision, etc. These are for the employees. They opt to take them. If they do, they pay 100% of whatever those premiums are. Do these supplemental insurances, are they included with the health?
No. So these rules only apply to basically your medical insurance and anything that is bundled with your medical insurance. If you have a medical policy and you have even say a dental policy or a vision policy and they're totally separate, your employees elect them separately and do not have to get them if they get the health insurance. Those dental, vision, AFLAC, life, disability, none of those are subject to these rules. So you're only looking at your medical plan and anything that is bundled with that medical plan that has to be elected together. So nothing else, you don't have to worry about any of those other benefits.
Just to add to that, so your standalone supplemental companies that offer a dental insurance, depending on their legal teams, either take a conservative approach or not, have offered or included the they have included the ACA fees as they see that it applies to them as well. So if you had dental insurance standalone that wasn't tied into the medical, there's additional ACA fees related to that as well that you could see in your renewal. So good question. We have a question right here.
If you have seasonal employees that are full-time during the season and it falls in this period and you have to get them insurance, then do you cover them when they're off season?
You cover them for the same months following the administrative period. So it depends on what your measurement period is you pick. So let's say that your season is in the summer, and I mean, there's so many scenarios that it would be hard to say what is best for any particular business. But let's say that summer is the busy time, so you pick a 3-month measurement period, and I'm going to do that kind of as an odd thing. Well, let's say it's 6-month measurement period, and June starts your busy season, so there's only 1 month of the busy season in there. Then you have an opportunity for an administrative period, and let's say that you choose 3 months, then by September 1st, you would have to, is that right? No. October 1st, you would have to cover them, and you'd have to cover them for 6 months. So you may be covering them if they're still employed with you. You would be covering them if they qualify during the measurement period. If they didn't qualify during the measurement period, then you wouldn't have to cover them during the disability or the stability period.
And
if they're not employees, you're not going to be covering them. Your insurance company will never cover them if they're not employees. So that's a tricky situation. And
that's Olive Branson.
Right. So Olive Branson has a lot of very complicated situations here when you're choosing your measurement period. And does everyone understand the measurement period, stability period thing, what it means? Okay, we'll just do a quick recap of that. And Patty's the expert on this, but I'll just give you a quick explanation of what we're talking about. So once you figure out that you have 50 employees and you know that you have to pay attention to these employer mandate rules, then you're looking at which of my employees do I have to offer health insurance to if I want to avoid a penalty? And that's anyone who's over 30 hours a week. If you hire someone if you hire someone who works in an office and you know they're going to work 40 hours a week all year long, you know those people are full-time employees. However, if you have people that work weird hours or they work only a few months of the year, if you have variable hour employees, then you look to this measurement period, administrative period, stability period framework. And this helps you to look at that employee's hours who doesn't work a typical full-time schedule. You look at that employee to see how much they worked in the measurement period, which is a look-back period of 3 to 12 months. You can choose whatever you want. You look at that employee's hours over that measurement period and see if they worked an average of 30 hours a week. If they did, and you have the administrative period following the measurement period where you have time to figure out which employees fall into that bucket. Once you figure out the employees that work 30 hours a week or more, then you have to cover them for the stability period, which follows the measurement period, and it has to be at least 6 months or as long as your measurement period, whichever is greater. And you have to cover those people, or you might have to pay a penalty if you don't. So that's what you do if you have these employees that are not working all year long. You're looking at them, and if you have seasonal employees and you choose like a 12-month measurement period, those people work a lot for 3 months a year, but they might not average out to 30 hours a week when you count them over 12 months. You see what I mean? If they only have 3 months of service, but over a 12-month period, it's probably going to average out. It might average out to below 30, which would make those people not full-time employees that you have to worry about. And that's where it gets complicated for employers, because you have to figure out what measurement period do I want to use that is going to create the best situation with my specific workforce. I've been sort of rambling here, but that's the high-level explanation of how that entire framework works. And you guys can ask if you don't understand anything that we're talking about. Just say, explain this basic concept, because nothing's really easy here. We just deal with it every day.
So
we have to offer that person 6 months in the following year.
Exactly.
But if we use a measurement period of 12 months, then we would have to offer that coverage for the full 12 months?
That's correct.
It
rubs both ways. So you might be able to ferret out some people that don't work for the whole year if you choose a longer measurement period, but then you also have to cover everybody else for the entire next year.
If you use that 6-month period then, and you find you have some people that you have to offer that to the following year for at least 6 months, who in their right mind is going to offer coverage for just 6 months and then cut it off? I mean, maybe I'm just got a disconnect here, but I don't get that. Why?
No, you are absolutely right. This is a question across the board as to how does this work in reality? What employer wants to be dealing with this every 6 months? Doesn't make sense for employers to deal with it every 6 months, because if you have that 6-month period, then you look at it for 6 months, the 6 months behind you cover them for 6 months, and then you're again looking 6 months behind to see if those same people continue to work 30 hours a week, and so you continue to cover them. So it's just, the shorter you make those measurement periods and stability periods, the more administrative work you have to do as an employer.
I have a subsidy question. I guess I want some clarity on, if we offer insurance, but we don't offer insurance to spouse and family, then would they still qualify under certain circumstances for subsidies for their spouse and family? Or if we offer insurance at all, that completely kicks them out?
If you offer insurance, group health insurance, spouses and kids are eligible to be on the plan, irregardless of what the cost is. That will disqualify them from getting a subsidy on the federal exchange. If, however, you don't allow dependents on, that would make them eligible. However, I may refer to the panel here. I don't think in 2014 you're going to be eligible to exclude children, potentially spouses, but not kids. Is that right?
You have to, yeah, and you guys back me up on this, but you would have to include children under 26 on the plan.
So then would that knock the spouse out from being eligible for subsidy if they went to the exchange?
Yeah, we've not seen any guidance in terms of whether or not an employer has to cover spouses, and you can speak to that.
Yeah, no, you do not have to cover your spouse under healthcare reform. Employers do not have to offer spousal coverage, and I believe that there are some examples of companies that are getting rid of spousal coverage for that exact reason, because it allows spouses to be eligible for subsidies in some situations. So there's no requirement to offer spousal coverage in your plan, and for some, it may or may not be advantageous to your employers, to your employees. Right. But that's a hard call, because if you have an employee with a spouse that's depending on that coverage, that employee will not be happy. If you have a employee where it comes to their advantage that a spouse can get a subsidy, then that employee will be happy with that. So that's one of the many examples where you are torn in a million ways.
I have a question about counting people. Many of the hotels and
Right.
theaters here are owned by a big family. And the one I work with has a big family, and they're owners/shareholders, and they have a platinum policy for themselves and don't have any for the regular employees. So I heard something about not being able to do that.
That is correct. At some point in the future, that will not be possible. So if you have a fully insured health plan, right now you can do something like that. You can have your executives have the greatest health insurance coverage day one, and the rest of your employees have a lesser plan. Part of healthcare reform was a decision to apply what's called the non-discrimination rules to fully insured plans. These rules currently apply to self-funded plans, and basically what they do is they prevent an employer from treating their highly compensated employees better when it comes to health coverage than the rest of their employees. And so if you have a self-funded plan, this currently applies to you. But if you have a fully insured plan, you've been able to do whatever you want, and you might have different coverage for different levels of employee or different eligibility periods, and right now it doesn't matter. This was supposed to go into effect already, but they realized that they needed to create some guidance on how to apply this, and they haven't figured it out yet. So it is something that is pending, and we don't really know when it's going to go into effect. My understanding is they are going to try to give at least 6 months of advance notice, and it would probably go into effect at the beginning of a year. So it might go into effect in 2015, I'm guessing. I'm guessing the guidance will come out in 2014. I don't know if anyone up here knows any different, but so if you are an employer that does offer better coverage to your executives, your top people, that's something that you're going to have to worry about probably next year, and you're going to have to make sure that you're not going to fail that testing by having that kind of structure of health coverage. So right now it's fine, but eventually they're probably going to have to change that. The insurance companies, I'm guessing, will be a part of that, but maybe.
So as that information is shared, the agents, your consultants will definitely communicate and relay that message.
Absolutely.
The question was if working shareholders count towards that, count towards the numbers, and it sounds like they may as well.
One other thing I'll tell you too, just on that same question is, we all know that year after year insurance costs go up. They never seem to get cheaper. And you know, when we talk about certain employees having these benefits and other employees maybe have lesser benefits, it's something that I think employers are going to automatically steer away from on their own. So when we went through the slide presentation, there was a whole page on taxes and fees, and one of them on there was the excise tax, or otherwise known as the Cadillac tax. And if your plan ends up costing, this doesn't take effect until 2018, but if your plan ends up costing more than, I think, $10,700 or some number like that, then there's just an arbitrary tax that's posted on top of that for you buying a plan that's just way too rich. And nobody's going to want to set themselves up to A, spend $10,000 on a health plan, and then B, pay a tax on top of it. So I think what you're going to see, even without the non-discrimination rules, is that people are going to, in each employer group, are going to kind of come together and start getting on the same plan just to avoid additional taxes, because there's so many taxes right now they can't avoid.
I have a question. Actually, it's two-part. Right now, our employee handbook doesn't allow seasonal or part-time to have any kind of benefits. It's only full-time that gets health insurance. So are you saying that we're going to have to adjust our handbook to basically say seasonal and part-time are going to be able to have benefits because of this, or how's that work?
You do not have to offer seasonal or part-time employees benefits as long as they work less than an average of 30 hours per week. If they're not full-time employees under all of these rules that we've been talking about, then you have no obligation to provide them benefits at all. So, depending on how much those employees work, if they really work less than 30 hours a week over whatever period of time you are evaluating it, you don't have to change anything about your current setup. The only time when people are going to have to change something is when they are characterizing their part-time employees as, some people don't have a 30-hour per week full-time standard right now. A lot of people have 40 or 38 and a half. And a part-time employee might be 30 hours per week under some people's standards. If that is the case, then those people are going to become full-time employees. If your seasonal employees work a lot of hours and they work for, maybe work for more than a certain number of months per year, those people might be technically full-time employees under the healthcare reform rules. So without knowing more about your specific workforce, I can't speak to that, but if they are part-time employees, you're not gonna have to change anything.
Okay.
There's no requirement to provide coverage to.
But during season, just like this other lady said, I mean, we have a restaurant and a golf course. During season, I mean, we will be working people full time because
it's true, but that does not necessarily mean they're full-time employees for these rules.
Okay.
And that's the important thing. You have to figure out who your full-time employees are for these rules, because if they might work 40 hours a week for 2 months, but that doesn't necessarily mean that they're going to average out to 30 hours a week over your measurement period, which means that it doesn't matter if they work 50, 60, 70 hours a week for any point during the year. They're still not considered full-time employees under these rules.
Okay, the second part of that then is, if, let's say, I find out that I do have some that are seasonal or part-time and they end up being into the full-time that falls under this, from an insurance perspective, I'm curious, is there going to be any company out there that's going to say, yeah, you insure them for 3 months or 6 months? I mean, I know from us, we have open enrollment. When people sign up, they can't just drop off willy-nilly when they say, oh, I don't want my insurance anymore. They have to stay for the full year. So how do these people get 6 months, and then we call the insurance company and say, well, our measurement period was 6 months, and so I don't need to pay for them anymore, and so I need you to drop them? I mean, how's that actually going to be implemented? Because it just seems like it's two different standards for the people that actually are in open enrollment versus the ones that I only want to pay insurance for 6 months. How's that going to work? Or maybe it won't.
And I think Rahgy hit the nail on the head when he talked about with all the TBDs to be determined. That scenario, you've obviously thought about it a lot, and I don't think they did. So, and that's what we're seeing as it gets flushed out. That was never their intention, for employees to get coverage and then for you as the employer to have to say, well, there it goes. So I don't know.
That's uncharted territory. All I can tell you at this point, and this isn't a great answer, but trust me, I have to give answers like this every day, is when that time comes, I want you to rely on a few different sources. Number one, your tax preparer. Number two, your insurance agent. And your insurance agent will connect with the billing and membership department at your insurance company, and they will keep you straight. I don't want you to think that this thing is entirely, the weight of the world on your shoulders. It's not. I mean, that's why you use insurance agents. People who don't use insurance agents, they're making a monumental mistake, a huge, huge mistake. That's what insurance agents do for you. They don't just get the plan for you. They fix problems when problems come up. And so I know that you're kind of telegraphing out into the future, but when that time comes, rely on your resources, okay?
Good question.
One other point that I hadn't thought about when she was talking about the employee manual, it may be that you want to update your employee manual under seasonal and part-time employees unless determined under the ACA that you qualify, will notify you with the proper deadlines, something like that.
Point.
Yeah. I mean, I think that they're going to have to, I think that's part of the reason why this whole thing was delayed a year, because things like that have not been figured out. For example, so you guys probably have a cafeteria plan in place, which allows your employees to pay for their benefits pre-tax. That, right now, you can't go in and out of that cafeteria plan because you are working 29 hours per week rather than 31. That's not an event that would allow you to start paying for benefits pre-tax or stop paying for benefits pre-tax. So things like that haven't been figured out by the IRS or the DOL yet. So that's a really good question, and I don't know if anybody knows the answer to it. So I think that's guidance that's going to come out next year, or else that we're going to have no way of actually complying with any of these rules.
So we had a question here.
You have proven to all of us is that most of us are not going to be able to figure this out by ourselves. Here's my question. I think this is a plausible situation for a lot of businesses in this area, in that we would employ a lot less folks from December 1st until March, the end of March, than we would at other times of the year. So if somewhere in there the 3-month measurement period happened, that probably is the time when the lowest number of folks would qualify for insurance. But it's unclear to me then later on when you add staff for the rest of the year, what do you do with those people? If you have the measurement period from December 1st to, let's say, the end of February, the 3-month period.
There's proposed regulations that define a newly hired employee. You make your best guess at that position, how many hours you think they're going to work, and if you think they're going to be working more than 30 hours a week, you want to put them in there and offer them insurance and pay them insurance after whatever the typical waiting period is for a new employee. So there's specific rules for what we've been talking about is ongoing employees, but if you have new employees, it's a little bit different. They kind of are trying to spell that out.
Does that answer your question? How all of these things work, especially for a lot of you in this room with employees that with workforces that are very seasonal, this is extra tricky for you, and a lot of it comes down to, again, this measurement period, stability period stuff, because you, as these people, as you hire them, you know they're going to be seasonal, which means you may not give them insurance right away because you don't know if they're going to be 30 hours per week. That is permitted, to not give them insurance right away if they're a new employee and they are going to be working on clear hours. And so with those people, you're going to be including them with your other employees and doing a look back and trying to determine whether they actually are full-time employees. I think that there are going to be more helpful guidance on how to actually do this, because we've been reading it and I still don't know if any of us really know how it's going to work for that particular employer. So, I mean, I don't know. I don't know if anyone else up here does. I'm not embarrassed to say that I don't really know how that employer is going to function on a day-to-day basis. So,
and the other thing in the regulations, what they talk about is whatever measurement method that you're using to determine all this, as long as it's consistent and reasonable, right, and that you're not obviously trying to get around the law, then you're going to be okay. You just have to do it in a consistent manner. But if it's obvious that you're always hiring people new, and your policy for your new people is always they're going to work less than 30 hours a week, and then they always start at 30 hours a week right off the bat, then you'll be subject to penalties. But if not, if you have that fluctuate a little bit, sometimes you guessed right, sometimes you guessed wrong, they're probably not going to assess the penalty to you. And then the whole penalty reporting and all that stuff that's another nightmare that's just laying out there that, they put it off to 2015. So after 2015, you're going to get the reporting in from the IRS is going to get the W-2s from the employers, but only the ones that have 250 or more employees electronically. Then they're going to have to process all the tax returns for the 2015 tax year. So they're supposed to have enough information by July 1st of 2016 to notify the employers that, hey, we think that you are liable based on the information we've got from the exchanges, Health and Human Services, and the tax records from the employees. We think that you're liable, and then they've got an administrative period there where you can, respond to them. I think right now they're thinking it's maybe going to be 90 days. So it's really going to be way delayed, and there's going to be a lot of facts that are going to happen in the meantime that will change that kind of thing. So I think if you can't get, in my opinion, if you can't get the exact answer that you need, it's do the best that you can given the information you do have right now and the guidance we have so far, and try to do some projections. And, because it's going to change. There's just too many questions about it.
I have a school district question. We provide insurance for all of our employees, Our bus drivers, we do provide insurance, and some of our bus drivers work as little as 20 hours per week. Since we do provide health insurance for employees who work 20 hours a week instead of the required 30, does that drop that down to the 20? For example, we've got part-time maintenance workers that are working 22, 23 hours. Can we not provide health insurance for them? Because we do for bus drivers who work 20.
So you're saying that, okay, well, if you have a lower threshold than 30 hours per week, it doesn't change the healthcare, the Affordable Care Act threshold for you as an employer. It's the 30 hours is still what the penalties are going to be based on, and it's not going to mean that that for anyone who you don't offer insurance who works more than 20 hours a week, suddenly you have to pay a penalty for them. That if you as an employer decide to offer insurance to more employees, you are not going to be hit by that under the Affordable Care Act rules. If you are offering insurance to some of your employees but not other employees, that becomes more of a, I don't know, employment law discrimination issue than a Affordable Care Act issue, I think, in my opinion. And it depends on if you have a reasonable classification for who you're giving insurance to and who you're not. If the group that you're not giving insurance to is, you know, a group of people that are all an older population, or they're all women, or whatever, you might have a lawsuit on your hands. But there's nothing that specifically says that you can't do that. If you have, you know, if you said we're not going to give health insurance to any of our bus drivers, that may be a reasonable classification depending on what that employee population looks like. So, but no, there's nothing under these rules that would require you to give insurance to anybody that works less than 30 hours a week. And really, you're not required to give insurance to anyone. It's just that you may or may not have to pay a penalty if you don't. I thought of one other thing that you guys might want to make sure that you know, because it's going into effect in 2014. It's the 90-day waiting period for your benefits, for your health benefits, for your group health plans. So effective January 1st, 2014, you cannot have a waiting period of more than 90 days for your benefits. So I know a lot of employers have a entry date that's first of the month after 90 days of employment. Some of you guys in this room might have that. You can't do that anymore effective January 1st, 2014. The coverage has to start on the 91st day, or you are not in compliance with this new rule. So make sure that you are looking at your eligibility and your waiting periods. So if you need to make any changes, that you're changing your plan documents and that you're changing your policy to make sure that you're not making people wait longer than 90 days.
Hopefully everyone can hear me. Our interpretation of that, and you guys can chime in, but that is on your renewal after January 1, 2014. So like if you're renewing with us, that would go into effect on your renewal after January 1, 2014. So if it's a July 1 effective date, that's when that portion of the law would apply.
I had a question with regard to the seasonal employees we've been talking about, or what we call seasonal employees. I think in Branson, a lot of times we know people are going to work full-time but not year-round, and we call that seasonal. It's our understanding that that the government has yet to say how they're going to define seasonal with respect to even being allowed to use the look-back period. And that if, you know, we might define it as 9 months, but the government might say it's 6 months, and if that's the case, then we would be required to offer them coverage from day one, just like other full-time employees, because we wouldn't be allowed to use the look-back period. Is that correct?
That's correct. The seasonal employee issue is is still up in the air. Basically, they have not provided guidance for how. They've said seasonal employees don't have to be counted in your 50 employee count, and they've given us some ideas of some possibilities for how you figure out who your seasonal employees are, but they haven't provided guidance on how to apply the penalties and everything to seasonal employees. So you're correct that more guidance is coming on that, which will be helpful to everyone in this room, because they just haven't figured out exactly how these rules work for those people. So you're right that right now we don't necessarily have have all the guidance we need on that.
And didn't they say that they're considering 26 weeks as the definition of seasonal?
I think that sounds right to me. I think right now we're advising to until guidance comes out to stick to 120 days or 4 months as the standard for who is a seasonal employee. But I don't know. I don't know if anyone else has it. 9-month employees are probably not going to be seasonal, but they might be. Like she pointed out, they haven't decided yet. So all the DOL and the IRS they previously requested comments on these regulations, and my firm gave some comments, and I'm sure a lot of people across the country gave comments on this exact issue and other related issues. So they're going to take those comments. Probably they got a lot of comments on the seasonal employee issue, and we're going to see what they do with them when they issue the final regulations, because they haven't come out yet. So so hopefully seasonal employers, gave some guidance that is, directly applicable to their field, and will get some reasonable regulations to help you guys out. So the question is, what happens to the seasonal employees when it turns out you're supposed to be giving them coverage, but it's when they're not employed? If a person's not an employee, you're not going to be able to cover them. No insurance company allows you to cover people that aren't employees. Those people will have COBRA rights if they have a termination event, but it won't be an employer obligation.
But if they're still on your payroll for 3 months, you haven't terminated them, and they're going to come back then again on April 1st, then they're still an employee. So if they follow that stability period, you've got to cover them.
Yeah, it depends on how you treat those employees when they're in their off season. If you lay them off.
Use the microphone.
Yeah, if you're laying them off once, say on November 1st, if you lay them off at that point, then they're no longer an employee, so you wouldn't have to offer them coverage because they're not an employee.
Yeah, I don't think that rule has come out yet to
Courtney,
figure out, are you if you're a seasonal employee, when is your termination? Are you still considered an employee on the payroll? That's gray area right now. I think that'll probably all come out with the seasonal employee regulations.
Back here.
This may be very similar to what you were just talking about, but what about, because a lot of us employ high school kids, college kids, retirees who are already on Medicare. That's another issue, because those people really aren't on their own. They're living under their, the kids are usually under their parents still.
Well, if it's the retirees and they're on Medicare, you don't have to worry about it. They're already covered and they're excluded from the
But if
plan.
they're a high school or a college kid and they're working and somehow they end up being considered somebody who is working more than part-time.
If those people don't have coverage through their parents, or if they don't have any other coverage, and you don't offer them coverage, then you might have to pay a penalty. Really, the key is you have to offer coverage to the right people. And who the right people are is what everyone is confused about here, and with good reason. But you really need somebody to sit down with you and look at your workforce and look at the rules that exist and tell you who the people are that you have to watch out for. But just because someone is a teenager or if they're a retiree, it doesn't really matter. They still are considered employees that you have to look at individually. If they have other coverage and you offer them coverage and they don't take your coverage, you're fine. You're perfect. And with someone who is on Medicare, someone who's on Medicaid, someone who's on their parents' plan, someone who's on their spouse's plan, those people, you don't have to worry about them as long as you offer them coverage if you're a large employer. If you don't offer them coverage, that's when you start getting into trouble.
How many of you use a payroll service to generate your payroll? Do you use the HR functions of that payroll service? apparently not. So most of you, do you pay a CPA firm to do your payroll, or are you generating it internally with your own employees? Raise your hand if you do it. Raise your hand if you do the payroll internally. You pay your employees. Okay, all right. You're the ones that you're going to need to maybe consider a payroll service, or sit down with your accountant or your CPA and say, hey, help me figure this out. Help me set up a worksheet, and if what I'm going to make available, you're more than welcome to use that. But the payroll services, I also, in kind of preparing for this, called some of them in like ADP. That's a part of their HR function of their payroll services. So it depends on if you had one of those services. They're going to have the software that's being written, and have the reports that you're going to need to determine that. They in particular mentioned that they have one of those calculators in software. I didn't get a chance to do a demonstration, but that may be a consideration for you, is do I need to use a payroll service to help me make sure I'm in compliance with this? It might make your life a little bit easier, because if you're trying to do it internally, you're going to have someone help you that understands the rules. So
yeah, I think just from the stability period, the measurement, the look back, all these questions are great. And if I'm hearing you guys right, there's still some more guidance that needs to come down, and we could probably speak 2 hours Q&A just on what that looks like. So we may look as an agency of putting together a more focused, just to really drill in on that as guidance comes down, so that it'll help prepare you for 2015 as well. I did want to just ask one question and kind of see if there's any more open-ended questions unrelated to the stability. One being for your employees that are part-time right now, are seasonal, that don't have insurance. What resources are available to help them, or to help our HR staff educate their employees on what's available and what they should be looking at?
From a carrier perspective, and I know all the other carriers do it as well. At Anthem, we do have multiple websites available for our employer groups. One is, it's makinghealthcarereformwork.com. That is going to give all of the different provisions. So we do a FAQ on each one of these provisions that have been talked about today. All of that is available on that website, and as our legal and as our internal guidance and external guidance determine the law, they go through and update those FAQs. And that web address is makinghealthcarereformwork.com, and that'll give you a ton of information.
We'll also have a link to that website on our website as well. So, and we'll share that. We'll send that email out with that information.
Could you comment on what's the individual and the company requirements to report to the IRS the cost of the insurance that they have? And two, do you think it'll remain deductible for the employer?
Number one, it's just for employers. I think it's probably indefinite, and it was really a kind of a data mining thing that I think the government wanted to know how much does health care cost in evaluating a lot of this stuff. So right now, it's only for employers that are required, that issue 250 more W-2s that are required to electronically file. So if you know you're required to electronically file your W-2s, then you're responsible for making sure to put the health care costs on the W-2s. It's both the employee's contribution as well as the employer's contribution. And again, it's just the core health care plan, not the, AFLAC or anything like that. It's not the dental plans unless it's specifically included in the health care policy. So the second question is, I don't think they'll ever make it taxable. That's my opinion. I think it got people really stirred up, thinking that's why they were having them put it on the W-2s when we started doing that last year. But no, it was just more of a data mining thing, and they're tapping the IRS's infrastructure to try to get the flow of information to everybody, because you've got an insurance company, basically, and now it's going to be the exchange, trying to determine if somebody, based on their income, if they qualify. Well, that's confidential information. Who's got that? The IRS has got that. Does the IRS have all of that? Well, so you got Social Security Administration's got to submit that probably electronically to the IRS. Even if it's not taxable, there's some non-taxable income that will be included in your household income in determining eligibility for individuals for these cost-sharing subsidies and the premium tax credits. So there's a lot of information sharing going on. The good news is your information is going to be out there because the insurers are going to be sending, the insurance companies are going to send 1095B form or something like that that's going to have the Social Security number, the name of the insured, of each of the insureds on the policy, as well as their address. But that information, that's shared with the IRS. The IRS double checks it, but they'll only provide the household income information only if somebody goes to the exchange to buy insurance. So your insurance, as far as if you're concerned about your individual household income, it's only if you're going to the exchange that information gets passed between the exchange, basically through Health and Human Services.
Yeah.
The record keeping, you will need to start record keeping for 2014 because that's going to be your period of figuring out the entire 12 months of 2014 if the employer mandate even qualifies. You'll start January 1, 2014, accumulating the information and identifying monthly because you're going to have to prove to the IRS that no, I don't qualify because I don't have 50 full-time equivalents. How did you determine that? That's what you've got to be able to prove to them. So, unless you just got a small company with 10 employees and that's it, that's pretty easy for you to accumulate that information. But it's if you have a lot of part-time employees, if there's ever any consideration that you might possibly be liable for it, you want to do the documentation, and it's for a full 12 months for that threshold.
For individuals that are self-employed, but they don't pay themselves a paycheck, so does their taxable income become what the bottom line of their tax return is?
The definition for the penalties for individuals is based on household income. And being the accountant, taxable income isn't necessarily the right description depending on what part of this law you're looking at. And that's the other confusing thing is it depends on what you're looking at as to what rule applies, and it's not necessarily the same thing all the way through. So for an individual penalty, it's household income, and that's their total income from their wages, interest, dividends, rental property, whatever it might be, the total income. And we're told it's supposed to be the adjusted gross income, if you all are familiar with that, and that you're going to add back if you had exemptions for foreign income, and then you're going to add back your tax-exempt interest and add back your tax-free or tax-free Social Security benefits. So if you're getting Social Security benefits of any kind, there's at least a 15% that would be added back, if not more, depending on what your level of income is. And then the thresholds are specific to the filing threshold. So if you take your standard deduction for your return and your personal exemptions for your return, if you fall below that, then the penalties don't apply to you.
We have time for one more question.
Is this going to affect COBRA, and if so, how?
So right now, there has been no change to COBRA. So if you have a qualifying event, you will still be eligible to receive COBRA. So there have been no changes. You will probably have more people losing coverage, possibly with employees being covered for a stability period, and then perhaps not meeting that 30-hour threshold for the next measurement period, and that loss of coverage will not necessarily be a qualifying event. I haven't really thought about that. That's a really good question. Do you guys have any?
One thing about COBRA is it's an option that a lot of people take. You lose your job, and you take the COBRA option because, if I have a medical condition, this is my only option. Going to the individual market, I get declined. But now moving into 2014, nobody's going to get declined in the individual market. And you know, if it happens, we talked earlier about qualifying events, and we used that example specifically about if you lose your job in the middle of the year, you can sign up and get new policy, but you can't just walk into an insurance agent's office and buy it just because. So one of the things that I think will be nice for a lot of people in this room here, large employers, HR administrators, we all know that COBRA can drive you nuts. I did it for 10 years. I was a COBRA administrator and an insurance agent at the same time. I wore a lot of hats, and when people returned their COBRA forms to me, it was almost my biggest nightmare because I had to keep up with that for the next 18 months. And now, if they find themselves with a better opportunity, not taking the COBRA, but rather going to the individual market, maybe getting a subsidy, it lightens your load a lot as a COBRA administrator. So she's talking about laid off people. They're laid off for a couple months. What happens there? In that situation, COBRA is probably going to be the best option. We keep it nice and continuous, moving all the way through.
If you're laying off your employees and you currently provide them COBRA, that you're going to keep doing that. Those people, if they have terminated employment with you and they lose their health care coverage because of that, they are going to have COBRA rights. Nothing is changing because of that. If you lose your health care, because you dip down below a number of hours and you no longer become a full-time employee, that should not be a qualifying event under COBRA where you would have COBRA rights from my perspective. So, but if you are terminating, if you have employees and you are laying them off and they are no longer employed, there's no change. There is no change. What we were saying was unclear was for seasonal employees, how you deal with those employees that are going to be employed for a certain number of months, and then they may have a rehire date, whether there's any implications for providing them coverage under these rules. But there's no change under COBRA, as far as I understand. So for COBRA purposes, if you terminate employment and lose your coverage, you have a COBRA event. So whether you're going to be rehired, you have lost your coverage because you have a termination of employment. So I think that is pretty clear. As far as healthcare reform goes, I mean, I like I said before, you can't provide health insurance to people that are not your employees because your carrier will never let you do that. Every eligibility provision in the world says that, you know, unless you are covering your independent contractors or whatever, but usually you're only going to be covering your employees. So, well, that's what we don't really necessarily know how that works for seasonal employees, because they're not necessarily going to be employed by you for the entire stability period that they're supposed to receive coverage under these rules. And I think that's where the missing guidance comes in on seasonal employees on how you actually apply these rules to them, because that doesn't exist right now. And your questions are valid, and I don't think any of us are entirely sure how these rules apply. But I will say that is because the rules don't exist yet.
Yeah, there's been a lot of information, lots of questions, lots of great questions, and we'll be around after we're done. So. If you have any more specific questions you want to ask on a one-on-one basis, we'll hang out up front here for a few minutes. Feel free to come by. Certainly ask any specific questions you have. Hopefully we'll have that answer. Otherwise, get back to you. But again, I want to thank our sponsors that were with us here today: Cox Health Plans, Cox Health Network, the local Tri-Lakes, Branson Tri-Lakes, SHRM, and Coventry and Aetna. A special thanks to our panel of experts, Courtney, Patty, Cynthia, and Rahgy. Thank you guys very much.